Tubal blockage is also known as fallopian tube obstruction. Is one of the significant causes of female infertility. That is one of the main causes of female infertility. The fallopian tubes are essential in the reproductive processes as they are pathway in which the egg travels from the ovaries to the uterus. If those tubes are blocked, that means the egg cannot meet the sperm, preventing fertilization. What can be the causes? The first cause is pelvic inflammatory disease, known as PID. PID is a major cause of tubal blockage and is often result of untreated sexually transmitted infections like chlamydia and gonorrhea. When you have these infections and you did not treat them promptly and you did not seek medical help while treating it, it can lead to obstruction. The next one is endometriosis. This is a condition where the uterine tissue that is normally lining the inside of the uterus grows outside of it, leading to scarring, which can block the fallopian tubes. When the tissue lining in your endometrium now is in the fallopian tube, it can cause blockage in those areas. The next one is previous surgeries. Surgeries in the abdominal or pelvic regions, particularly those involving the fallopian tube, can lead to scar tissue formation causing blockages. Maybe you have done a surgery at the pelvic wall, maybe appendicitis and other forms of pelvic surgeries, maybe endometriosis surgery. It can lead to scarring. The next one is ectopic pregnancy. An ectopic pregnancy occurs when a fertilized egg implants inside that's supposed to implant inside the uterus now comes outside the uterus. That is now implants in the fallopian tubes, which can cause damage and blockage to the fallopian tubes. If not arrested early, it can cause that part of the fallopian tube to have a wound that causes obstruction. The next one is fibroids. Uterine fibroids, especially those that grow near the fallopian tubes, can cause blockages. As you know that these fibroids have the ability to grow in any part of the uterine cavity. You get, when they now grow on areas near the fallopian tubes, they can cause blockage to that area. The next one is congenital effect. Some women we are born with structural abnormalities of the fallopian tubes that can lead to blockage. Some women are born with serious problems of the fallopian tube. Maybe some even are born with blockage of fallopian tubes, as it is now more severe. You get, so this fallopian tube blockage can be inborn too, not just a problem of infection. How do you prevent this? By going for a regular STI testing and treatment, practicing safe sexual practice, always use condoms and have regular STI screenings, especially if you have multiple sex partners. Early detection and treatment of this STI can prevent the PID and subsequent tubal damage. You know, long-term consequence of PID is tubal damage. The next one is partner treatment. Ensure that your partners are treated and tested to prevent reinfection. If you are always treating an infection, make sure that your partner is also getting the treatment too, because if not, after treating the infection, they will reinfect you, and that will cause increase in resistance to your body. Then the next one is management of endometriosis. Early diagnosis. If you experience symptoms like of endometriosis such as menstrual pain or chronic pelvic pain, seek a medical advice early. Early treatment can help prevent conditions from worsening and leading to tubal blockage. You know, these things are controlled by hormonal imbalances. Once your hormones are balanced, it will return to normal. The next one is medical and surgical options. Depending on the severity, doctors may recommend hormone therapy or surgical procedure to remove the endometrial tissue and reduce the risk of tubal blockage. It depends on how severe the endometriosis is. There is some that can be treated with hormone therapy, while others can be treated with surgery. The next one is avoiding unnecessary surgery, minimizing invasive procedure when possible, opt for less invasive procedures as this reduce the risk of scar tissue formation. Not any slightest thing you go for surgery. Always seek for other options. You might get lucky and be treated. If you undergo any abdominal or pelvic surgery, follow your post-operative care instructions. The next one is monitoring and managing fibroids. Regular checkups, regular gynecological exams that will help you detect fibroids early is very important. Fibroids are detected, discuss the treatment options with your doctor to prevent them from causing tubal blockage. If you leave them to outgrow a normal size, it can cause damages to your uterus and other surrounding tissues. So the next thing you should do is maintaining a healthy lifestyle. Maintain a healthy diet and a regular exercise to support your overall reproductive health. Avoid smoking because smoking can lead to a higher risk of infertility, including tubal damage. Manage overweight because it can exacerbate conditions such as endometriosis and fibroids. Seek early treatment for pelvic pain or irregularities. If you're experiencing symptoms like unusual pain, irregular menstrual cycle, or pain during intercourse, seek medical evaluation early. Early diagnosis and treatment of potential underlying condition can prevent tubal blockages. So, if you experience any of those symptoms, don't hesitate to consult your doctor. Alternative treatment, non-surgical options such as a non-surgical fertility drugs can be given. Intrauterine insemination might be sufficient. These options are less expensive than surgeries or IVF. Fertility clinics. Some fertility clinics offer payment plans or sliding scale fees based on your income, so you should check them out. Preventing tubal blockage involves a combination of proactive health measures, early intervention, and maintaining a healthy lifestyle. By understanding the causes and implementing these preventing strategies that I have mentioned, you can reduce the risk of tubal blockage and preserve your fertility. And if infertility becomes an issue, exploring insurance options and other treatments can be needed. So if this video has added value to you, don't forget to subscribe to this page, like this video, comment on it, and turn on your notification bell to know whenever I post my videos. See you in my next video. Bye.